The Food and Drug Administration is one of the most important agencies in the federal government and the world. Every day, the FDA makes life and death decisions, whether to approve a new cancer drug, initiate a recall of contaminated food, or keep deadly tobacco products out of the hands of our children. This agency, the Food and Drug Administration, oversees 20% of the entire American economy, nearly $3 trillion in product and services, on a budget, the FDA budget, of $6 billion annually. Yesterday, I met with President Trump's FDA nominee, Dr. Marty Makary. It was a good discussion. There are areas where I imagine we would be able to work together, such as promoting healthy food or addressing deceptive direct-to-consumer prescription drug advertisements you see everywhere on television. These commercials overstate the benefit about the latest wonder drugs, rattling off side effects so quickly you can hardly hear them, but always keeping you in the dark about one crucial element on each one of these drugs. How much does it cost? My bill, which I introduced with Senator Grassley, Republican of Iowa, would end Big Pharma's secrecy and require these ads to show a price tag. Just that simple. They declare the price and they advertise it. I appreciated Dr. Makary's comments that a medication can give a patient false hope if it's not affordable. But let me share my concerns with Dr. Makary's nomination in general. The FDA requires a commissioner who's willing to withstand a lot of pressure from big pharma, big tobacco, maybe even the president, to protect public health. We cannot afford an FDA commissioner who gets chewed up by Elon Musk's chainsaw or stands idly by as RFK Jr. pushes his deadly bias against vaccines. To safeguard and regulate the food we eat and the drugs we use, we need a leader of the Food and Drug Administration with the courage to say no. Cigarettes are responsible for more than 480,000 deaths each year. They were responsible for my father's death. So when I came to Congress, I vowed to fight this entity. While we have succeeded in reducing youth smoking rates, anyone who thought big tobacco would disappear was mistaken. They rebranded with flashy new products, vaping, e-cigarettes, and they follow the same playbook they used to drive sales of Marlboros back in the 80s. Target kids. For years, the Food and Drug Administration utterly failed. This is during the Biden administration. As a Democrat, I'm reluctant to say it, but it's true, and I'm going to say it. For years, the Food and Drug Administration utterly failed to protect children from a lifetime addiction fueled by e-cigarettes, many of which are sold by the largest tobacco companies. Under the law, a vaping product is required to first prove to the FDA that its product, e-cigarette, is, quote, appropriate for the protection of public health. That's a requirement under law. They have to prove that before they can sell on the market in the United States legally. It didn't happen under the previous Food and Drug Administration. Instead, thousands of dangerous, highly addictive e-cigarettes illegally flooded the market without FDA review, hooking a generation of kids. By law, FDA is required to remove all unauthorized tobacco products from the market. In fact, it could do so today. So the question is, will the new president's FDA nominee follow the science and the law to protect our kids? Or will he align with the tobacco corporations that peddle this poison? At the same time, President Trump and Elon Musk have fired thousands of federal health workers. Before you run off celebrating efficiency, let me tell you who was terminated. 120 cancer researchers at the National Institutes of Health who are running clinical trials for new cures. Disease detectives at the Centers for Disease Control who help identify and respond to outbreaks of new virus. Does that sound like efficiency to you? To tell these cancer researchers we don't need them any further, any longer? At the FDA, those fired include inspectors of drug manufacturing plants, regulators in charge of recalling faulty medical devices, and those monitoring the safety of infant formula. For goodness sakes, we have a measles outbreak in Texas that has killed 2 and sickened 220 people, mostly unvaccinated children, It is the worst measles outbreak in a generation in America. Instead of encouraging vaccinations to save these kids, Secretary Kennedy diminished their significance by falsely stating that measles outbreaks are not unusual, his words, and issuing a statement about the outbreak stating that, quote, the decision to vaccinate is a personal one, end of quote. Well, of course it's a personal one, but what is his position questioning the efficacy of vaccines doing to that personal decision process for the ordinary American? NIH is cutting 40 grant awards for promoting a vaccine updates and addressing hesitancy, which breaks the promise that he made to Republican senators who were skeptical of his nomination. The list goes on. You cannot claim that you want to make America healthy again and then allow preventable diseases to come roaring back, all while firing scientists working to address these challenges. Will Dr. McCary stand up to Mr. Kennedy and encourage parents to vaccinate their kids? Will he stand up to the buzzsaw of Elon Musk's chainsaw, to big tobacco? I hope that he will. Mr. President, I yield the floor and suggest the absence of a quorum.